Good day. I'm Matthew Mamaneric, founder of Rx4MentalHealth. And what I want to talk to you today about is a mental health program for the workforce. We have found that improved mental health dramatically improves productivity. As you probably know, there's a mental health crisis in the US and actually worldwide today. The stats keep showing over and over how bad it has gotten. In the workplace, it's even worse. 1 million Americans miss work each day because of stress. This costs $51 billion per year and an additional $26 billion in just treatment costs. As well, today and every day, 63% of your workers are ready to quit due to stress. The cost per employee, as figured by the National Safety Council, is $15,000 per employee. And young workers actually fare worse. 20% of work week is gone due to mental health for Gen Zers and young millennials. That's 1 day a week is gone because of that. There's reasons for that, but it's true, it's real, and it's affected. Studies show that the number one benefit that Gen Zers and young millennials want is a mental health program. Well, we have EAP, you may say. EAP was great, it just doesn't quite cut it anymore. It's got limited in scope and referrals are needed. Typically, EAP only has 5 to 7 visits allowed, and you'll see later on, it takes almost 13 visits before a patient, an employee, starts to feel better. And it doesn't cover core issues. It doesn't have real counseling. It can take several visits to see results, and it is very expensive. We had a safety director said that his deductible was not covered, so he had to pay $150 per session. He got a bill for $450 after 3 sessions, and he had to quit. And it carries a stigma if you have EAP in the workplace. Employees walking into an office, everyone's wondering what's wrong with you. So therefore, it's not used. Now, we're not saying that all stress should be eliminated. In fact, we know that some stress is productive. You want to get a project done, you want to meet a deadline, you want to lower your operating costs, you want to improve customer experience. These are all great things, and teams can work together. This is a picture of the South African rugby team several years ago when they won the World Cup. It takes personal responsibility to build up a whole team, and we get that. We're for that. It's when you get on the right side of this optimal performance curve where you get strong anxiety, and then you have a complete meltdown, like many of the Gen Zers are, and losing a day of work per week. What happens when there's no treatment for mental health in a workplace today? Studies show that according to data supplied by the American Psychiatric Association, employees with unresolved depression experience a 35% reduction in productivity. And when there is treatment, on the opposite side, 80% of employees show improved levels of work effectiveness and satisfaction. And according to data supplied by Canada's leading mental health teaching hospital, it shows that 75% of workers want to have a program that the workplace does not have. Research article by Atticus stated the most commonly reported injuries, now we're talking about disability, not just matters of mental health. Most commonly reported injuries, making up 52% of cases, were related to mental health issues. In conclusion, according to Graham Cohen, the link between mental health and accidents in the workplace is clear. Companies must prioritize the mental health and well-being of their employees to reduce the risk of accidents and injuries. Now, what about claims for your health insurance? One of our clients, Dr. Larry Earle, of the National Association of Occupational Health Professionals, pulled up this claims statement. These are for chronic conditions. 3 of the top 6 healthcare insurance claims are due to mental illness. So what's the cost now of not having a mental health program? According to the National Safety Council, They have an employer cost calculator, mental health calculator, and it requires just 3 pieces of information. They need just the state, let's take Ohio where I live, a business, manufacturing, and number of employees, 400. What do you think it costs you per year? It costs $579,334 per year by not having a mental health program. This is in lost time, absenteeism, and presenteeism, job turnover and retraining. People quit, they ghost, they have to be fired, and then the actual healthcare costs like we just showed in the previous slide. They all add up. And what's more, if you're dealing with European companies and you're a vendor to one of them, you may be required to now offer a mental health program because they have socialized medicine, and Europe has now required a psychosocial requirement for all workers. So we talk about health insurance, but we think it may not be the best choice, the best solution. And why not? First of all, the high deductible and the high cost. I talked about that safety director who, after 3 visits using his health insurance, where his deductible was not covered, it cost him $450 and he had to stop using it. And is it adequate coverage? Oftentimes it's not adequate coverage. And then does it increase the premiums? We show that 3 out of 6 top chronic conditions were mental health related. Yes, it's going to increase premiums for next year. And is family covered? Typically the family is not covered. Then there are long wait times, fewer provider options. There's a stigma of using it. And there's poor EAP utilization like we talked about before. Well, so what do we do? What kind of a program can you imagine there being? Well, can you imagine a mental health solution that is not tied to insurance and so it doesn't affect premiums? It's on demand, accessible, you can get quick appointments, it's affordable, it includes the whole family, especially teens. It's anonymous, there's no stigma. It's available nationwide. It has licensed psychologists and psychiatrists. There's no bots or apps. It's virtual, so it's easy to use and agile. All right, that sounds great, right? Where are you going to find such a program? We found such a program and we partnered with them. And that program is Teladoc. Teladoc is the country's oldest and largest virtual telemedicine company around. Wait, you say, we know of Teladoc. I think even our insurance has it, but it costs $99 per visit to use that. Normally, yes, it does. But that's if you go there on your own. With us at Rx4MentalHealth, we're different. We are on-demand Teladoc mental health for just $39.95 a month, and that includes the whole family, ages 13 and above for the mental health. Now, how do we do this? We do this because we tie in your company with all the other millions of users, and that lowers the cost overall. It's a great program. It's just using like a streaming service like Netflix. Why does it cost so little to watch a great movie? Because everybody's paying for it. It's the same principle. So what do we have here? We have an affordable price. We're accessible. When I say accessible, you can get an appointment within 72 hours of signing up. There's no consult fee. It's anonymous. There's no bots or chats. It's all live therapists used as a phone or as a face-to-face type visit. It's all HIPAA compliant and secure. It's nationwide, over 11 years, over 25 million members, and all licensed doctors, psychologists. And it's agile. It's on your schedule. Lastly, there's no contract. We don't have to sign anything for a whole year. There's no need for open enrollment. We can start next month, start helping your employees right away. And not only helping your employees, but helping your employees' families. 69% of employees, when they ask for a benefit, do you know what they ask for? They want to know if they have mental health coverage for their children. Yes, now they do. All included, zero extra cost. That is awesome. What would that mean to so many kids who are struggling? You know, there's crisis situations happen. What if we could avoid that? That is just wonderful what we offer here. And our price is fantastic. Let's show a comparison. Our Rx for Mental Health saves a lot of money. We said before, EAP doesn't cut it because it takes on average 12.7 sessions, and at the bottom is a reference for that. 67% of patients improve after 12.7 sessions. The cost of that on a normal situation at $195 per session, that's the average nationwide cost of a therapist, is about $2,500. With our program, it's only $300 for the exact same amount of time. Now, whether you're a self-insured company and you pay for all the employees or the employees have to pay, this is a huge savings. It's a huge savings directly and next year for premium costs. This is our comparison chart. Who else is out there? This is a little tough to read. It's a picture, but this shows all the other employee programs that are out there. BetterHelp, TalkSpace, Amwell, MD Live, and even Teladoc is in there. And look across the top. Across the top are all the benefits that we offer, and all the red marks are what they don't offer. We cover everything at dramatically lower prices. BetterHelp, $260 a month. TalkSpace, $400 a month. You know, we have Amwell, $109 for a master's level therapist per session. Okay, and then we go on and on and on. And what do we offer besides this? We offer not just the Teladoc mental health program. We offer 3 more programs. We offer 24/7 counseling service too. 2 o'clock in the morning, your dog gets hit by a car in the street and gets killed. You're all despondent. You need to talk to somebody right away. We're there 24/7, 365. 6 sessions per incident. And then we can schedule you right to the Teladoc Mental Health to take on from there for as many sessions as you need. No cost to you at all. And then we have Teladoc regular medicine services for the whole family, not just 13-year-old, but the whole family. You have a 7-year-old, it's 5 o'clock at night on Friday night, and there's a fever. What do? You can't call the pediatrician's office. You don't want to go to the emergency room or urgent care. My gosh, you call Teladoc. They have a FaceTime app. You can show you can see the symptoms. He'll ask you or she'll ask you what the vitals are. They'll look at your child on their FaceTime view and determine if you need medication, which they can send right to your pharmacy if medically necessary. Or they'll say maybe just rest at home, or yes, you should go to the emergency room or urgent care. Then lastly, we have our healthcare advocate solution. We use this a lot. This does 3 services. One is it'll find specialists for you. Let's say you need a pediatric podiatrist. They'll find that within your insurance. And then you may need to find specialty care for either elderly parents or special needs child. They'll help you find that care. And then lastly, they will negotiate to lower your bills. We've used this service a lot, and it has saved us thousands of dollars. Now we say this is separate from insurance, and it is. This is not insurance. And why is this good? This is good for several reasons. Copays and deductibles on healthcare deter employees from using needed mental health care. If they have to go through the process, they're not going to do it nearly as much. And we showed the study before, if they don't use it, productivity goes down by 35%. This is all without claims on your healthcare plan, so your costs go down next year. So average therapist bills through normal insurance, as we showed, are $195 through normal sessions plus normal health insurance monthly premium. Very expensive. More health claims means bigger rate hikes next year, and typical telemedicine does not include the whole family. Ours does. If you're in the back office, you want to know how the stats are working for you, we give you back office visibility without knowing who your employees are. This is total anonymity. It's all HIPAA compliant. So this shows here what you can see on the back office. You can see how much you're saving by using this service. And how do we know that? Because we ask a survey. If you weren't using this, where would you go? If they say emergency room, urgent care, primary care, they add up all those costs. And that's how you get the savings, because ours is 0 cost to you. Then we say, where do you go if not available? 61%, there'd be no treatment. We'll show in the next slide what that means again, 35% reduction in productivity. Then if you're into stats and improving your whole workplace health, you can see what diagnoses there are and what prescriptions there are. The diagnoses can help you build programs to help curb those diagnoses. And if you have a good prescription program, you can lower your costs by working with the pharmacist. And look here, the upper right. Satisfaction, 100% is either excellent or good, with most of them being excellent. In this monthly example, 82% were excellent. We talked about no treatment. 65%, if they didn't have this program, would have had no treatment. That means a 35% reduction in productivity. What does it mean now? Now it means an 80% improved levels of work effectiveness and satisfaction. So we're not just a benefits program. We are a productivity and risk reduction program. We are a program that enhances the quality of life for your employees. And that's what employees want today. New studies have shown that the #1 benefit sought is a mental health benefit, because new employees care more about the benefits and working well with others than they actually do about their salary. What kind of a cost is this? Is this expensive or is this a good deal? According to the National Safety Council, this is a good deal. It's a 3-to-1 ROI we show, but they say it's a 4-to-1 ROI. But let's go back to our numbers. With 50 plus employees at $39.95 a month, is this expensive or is this a deal? Let's take the numbers. According to the National Safety Council, the cost of not having a mental health program like ours for 50 employees in Ohio manufacturing is $70,000. That's combined lost time, turnover, and healthcare costs. The cost of our program for the year is $23,970. That is a 3-to-1 ROI. This is a deal. So how is this delivered? Do people go somewhere? This is an app on the phone. You just open your app, you click on the service you want, like the counseling service, or the mental health, health advocate solutions, or the teledoc. You set up your appointment for the mental health and the time, and you can do, typically the days are available within 48 to 72 hours by provider. You can pick different providers, ones that are male, female, ones that deal with PTSD, one that deal with counseling for marriage, etc. And that's how you go. And we can even put your company logo right on this app. So it shows ABC company, discount medical card for medical benefits. All this is included for you at that same price, no additional cost. So what's the best way to engage with us? Best way to engage with us is the best for anonymity amongst all your employees, and the highest utilization, which means the highest productivity, is for the company to purchase it for everybody. And you're not going to lose money. You're going to make money on this. And so how do you get a hold of us? Either agent will get a hold, will work with you and work with me, or you can call me directly. If you have an agent, we ask you to use that agent because they will be your frontline person. I want to thank you very much for listening to this. This was about 16 minutes, and I hope it wasn't too boring for you. Have a good day.